Hey everyone, hey everyone, hey everyone. Yes. So I want to say hello to everyone. I want to, oh, come on, camera. My camera's acting crazy right now. But I wanted to come and do a video, my first video, and it has to be about my surgery. But I wanted to do a video of my surgery that I had. A lot of people wanted to know, so I'm letting y'all know. So first I'm going to start off with the surgery. The surgery that I had was called Quervain Tenosynovitis, which is, if you're going to Google it, is Dequevains Tenosynovitis, Tenosynovitis. Ooh, that's a long word. Could have been the spelling bee. But anyway, what Quervain Tenosynovitis is your thumb or your hands has tenons that goes down each way. You have also nerves in between there. And then right here you have a little band, like a little rubber band to keep your hair in a ponytail like this. But there's a band right here. And of course, you have your bones and your muscles and everything. Well, what happens is your tenons, the help you do this, when it gets inflamed, this band right here does not expand at all. It basically compresses your tenons, so it prevents your hand or your thumb from moving. You can't give thumbs up or your hands or whatever, but it prevents it from moving when your tenons are swollen. So what happened to me was the tenon that goes right here from my thumb was inflamed, and my sheath prevented my thumb from moving. So any slight movement, any thumbs up or writing or typing, it will hurt like crazy. So what I did was I researched it first. So I kind of diagnosed myself, but I researched it first. So I went to Google, typed in, the symptoms, what everybody does, typed in the symptoms, and they, based on the symptoms, it's like, okay, well, do what they call a Frankenstein test. And what a Frankenstein test is, you take your thumb, and then you put it in the middle of your palm, and you cover your hand, your fingers with it. Then you go straight and you move it like this. If you're not able to move your hand in such motion like this, then you have what they call Quervain Tenosynovitis. If you're able to move it, but you're still feeling some pain or whatever, you may have gout, you may have arthritis, you may have carpal tunnel. But with the Frankenstein test, it basically, if you cannot do this, and with this hand, I was able to do nothing. So I would press down and couldn't do anything, and my hand would not move as such as this. And sometimes your doctor will kind of move your hand to see, but anyway, so I decided to go to an orthopedic. So she told me that, of course, I did diagnose myself correctly, and I got a steroid shot. I got that back in April of this year. It only lasts for about 3 months because I was back in her office in June. So she stated to me that I can get another one. However, it will be less effective because the first one is supposed to work. And usually 9 times out of 10, it does work for some people. So if you do have this and you get the steroid shot or cortisone shots, what are the shots they call, it may work for you to where you may have just that one shot and you're good. What it does, it deflames your tenons so that you're able to move your arm and move your thumb or whatever. And it's supposed to work. It's supposed to be a permanent fix. If it does not work, then they may put you in a brace. I was in 2 different braces. I had a brace to just cover my thumb and around here. And then I had a whole brace that covers my hand. And usually they tell you to be in that brace for about 4 to 6 weeks. I had the brace on for a heck of a long time, really. I kept taking it on and off because of the itchiness. It made me itch. I I really couldn't eat food with it on. Couldn't shower with it on. Sometimes my hand would go numb when I'm asleep. But wearing the brace every day didn't seem to help. It just kind of seemed to deflame the tendons a little bit, but did not cure it completely. So went back to her and let her know, hey, the brace didn't work. So the next step was surgery. So in the surgery, there's a lot of surgeries on YouTube that you can see that it kind of gives you step by step exactly what they do. All they do is they go in, and I can't really point that way, but I have like a little cut right about here on my arm. I put it this way, about here on my arm, and it's about this big. So what they do is they cut you open, they spread the skin, move your tissue, the muscle. They find your vein, or your nerve. They find the nerve, they push the nerve to the side, and all they do is they cut that sheath in two. Sometimes they remove it, but in some cases they just cut it. So they cut your sheath and split it in half or whatever. Then they go to your other side of your tendons, which you have, of course, too. But they'll cut the sheath here, and then they'll look over here to make sure that you don't have any, if it's inflamed over here as well, they'll cut that sheath. And then they'll try to cut a little bit here. So that way they gives your hand some motions. So I was awake during the whole procedure. I didn't feel anything. I got 2 shots in the spray. So they did the cold spray first, and then they shot me twice. Numb my whole arm. The numbing part burns like crazy. I'm not a pain person, but they numb my whole arm. After that, I had to wait for like 10 minutes before I went to like the surgical area. Went to the surgical area, and that's when they did the surgery. For all day yesterday, because yesterday was my surgery, all day yesterday, my hand was feeling fine from my surgery being at 8:45, about 8:45 when I went to my surgery, till about 6 o'clock that night. I didn't have no pain. My hand was still numb. I was good. I was like, ooh, you know, I'm great. But once the numbness starts to wear off, that's when the pain starts to come. The pain first started here, and then it just slowly crept up. And my thumbs, these 2 fingers were still numb, and I couldn't feel anything. I was like, I thought I was going to lose my fingers for real, but I couldn't feel anything. I was still numb up here, these 2 fingers. But everything else, the feeling came back, and it came back massive force. I've taken the pain medications. It worked for a little bit. The pain medications basically took about 35 to 40 minutes before it kicked in. And then when it finally kicked in, it made me sleepy. So it works in a way, but it does this thing. You can either opt to take the pain meds that they give you, or they would suggest like Motrin or Tylenol or whatever type of pain medicine that they give you. They will tell you to take that. Mine's told me to take the pain medication if needed, but if my pain is not that severe, then I can just take, over-the-counter medication. So today I've taken the Motrin. I've taken Motrin today. It's feeling okay. My fingers are not numb anymore, so I can feel my fingers now. I do have pain here still. I'm tempted to take this off to look, but there's like a piece of tape that you cannot take off. They have to take it off. But when I tell y'all, I didn't watch the surgery. I could have watched them cut into me, but I didn't want to watch it. But the time that I did look back over at her, I saw my skin just like scrunched up with thread in it and blood. And I was like, ew, no, I'm not even watching it. But I did watch her bandage it up and stuff. But with that said, again, right now I'm in a little bit of pain. I was in a lot of pain yesterday, but I'm in a little bit of pain now. It's kind of difficult to sleep, but you kind of get used to it. My left hand's got used to doing a lot of things, so I just had to make sure that I'm just keeping it elevated. They tell you a lot of time to keep it elevated above your heart rate. They kind of help the swelling go down, which is real good. If you aren't, like, when you sleep, try to, like, if you sleep on your stomach like I do, I try to elevate it like this. If you sleep on your side, to kind of elevate it, like if you lay down, elevate it like this. Or if you lay on your back, kind of elevate it like you're holding on to a lap bar to go on a roller coaster. But keeping it elevated is good. I did use the ice pack. I had one of these ice packs I bought from Walgreens. It's just like a Walgreens instant cold pack that you can get. But it lasts for about a good 20 minutes. And what I do is I place it right here on my arm, and I will hold my arm up. And that will be the best thing. And sometimes I just put my blanket right there and kind of hold my arm up. But that would be the best thing to do. Don't put it on your womb or your fingers, anything like that. But to put it right here and just hold your arm up and just keep it up there for about 20 minutes. That will be, that's a good way to reduce the swelling. And it does take away the pain a little bit. I'm not going to say 100%, but it does take away the pain a little bit. But other than that, hopefully it's worth it. I'll definitely make a comeback video of whenever I get this taken off. I have to wear this for about a week. And then next week, I go back to her to take out the stitches and stuff like that. But again, if you are having symptoms as far as pain in your wrist, if you have pain, especially and you would know if you have it. Well, I can't say you would know if you have it, but it will kind of give you a sign if it hurts right here, like, oh, well, I did it perfect. Between your thumb and your wrist, that little bone, if that little bone right there hurts, like that little area at all hurts, then go ahead and try to do, like I said, the Frankenstein test. Is just putting your thumb in your palm, folding your hands over your palm like that, and just move your hand back up and down like this. If you can't do that, if you're stiff, or if you try to do it and it hurts, it is a positive sign that you might have the Quervain Tenosynovitis. If you can't give a thumbs up, like I was like this, ooh, thumbs up, thumbs up. But if you can't give a thumbs up because if it hurts, that is a problem sign. Especially, like I said, the normal pain will hurt right here. But definitely try those things. But those are some of the symptoms that I did find out that, hey, I do have the Quervain Tenosynovitis. Definitely take a look it up. There's, like I said, there's a lot of videos on YouTube. I could have videoed mine, but I didn't want to because I didn't want nobody to see my bloody skin. But there's a lot of videos on YouTube about the surgery. There's a lot of doctors out there that explain it, kind of give you visuals. I can only give you personal experience because I've just had it done. But definitely take a look at it. If you have any questions, please go see an orthopedic doctor. They are the best to go to about this type of stuff, especially if it comes to your wrist or arm, because you may think that you may have the Quervain, but you may wind up having like gout or arthritis, because I thought I might have arthritis, the reason why I couldn't move it. Or you may have carpal tunnel. But of course, if you have those symptoms and you go to your doctor and say, hey, look, I have this pain, I can't do this with my thumb or my fingers or whatever. I did what they call the Frankenstein test, and I couldn't do that. I'm showing too much of a positive sign of it. I think I have the Quervain Tenosynovitis. And what they'll do, they'll, kind of examine you and kind of do the same test again, and then they'll say yeah or nay. So I will come back with another video. I'll probably show y'all my scar once this is getting taken, once I can take this off. But I hope this helps y'all out. For anyone that is going through any kind of wrist pain, get checked out because you never know what it is. All right?